Hi, everyone. This is Dr. Saul, and today we're going to be talking about the musculoskeletal system, just an overview, talking about joint disorders. So let's get started. So just the kind of general overview of the skeletal system. The skeletal system is made up of bones, joints, cartilage, ligaments, tendons, and bursae. And so the bones are the primary component. That's what you think of when you think of your skeletal system. There are 206 bones in our body. And so those are what make up a large component of our body. And it's that structure that we have that keeps us, able to stand, to walk, to move, all of those things. What we also have are joints, which are junctures between two or more bones. So think about, in your hands, you have joints, elbows, shoulders, knees, hips, all of those locations where two bones are meeting is considered a joint. And between the two bones meeting at that joint, there is cartilage, which is connective tissue used to kind of lubricate and protect the bone from rubbing against another bone, which would be really painful. So we need that cartilage to help with movement, to help with preventing any pain or injury. And then we also have ligaments, which connect tissue to bone or connect bone to bone. And then we also have tendons, which connect muscle to bone. So both of those kind of working together, you'll have, your tendons. Think about like your Achilles heel, your Achilles tendon. You'll have ligaments as well. Think about like your knee, connecting the kneecap to the bones surrounding your knee to keep your knee in place and to be able to have all of that movement that we have. And then we also have bursae, which are fluid-filled sacs that provide an extra cushion, more than just that cartilage, to protect our bones and tendons from any damage or any discomfort that it might cause by bones rubbing against each other. Within our joints, we have three different types. We have fibrous, which are immovable. Think about like in your skull, you have these sutures. So when you're a baby, they are separated and then they come together and they join at these lines. So you can see those here. And so these sutures are used as are fibrous joints. Then we have cartilaginous, which is where we have two bones with cartilage usually between them. These are semi-movable. So think about your vertebrae in your back. And then we have synovial. So these are freely moving. So think about like the joints of like your shoulders or of your knees, those places where there's a lot of movement that can happen in that area. And so there's the synovial fluid that again helps to protect and to allow for easy movement. Within the skeletal system, there are lots of different places where you'll have those synovial joints. So there are synovial joints in your wrist, in your elbows, in your cervical region, so between C1 and C2, which helps you to move your head from left to right, so like shaking yes and no. There is also ones in your hips and your shoulders, again, in your wrists, and then in your feet as well. So you can see there's lots of different types. You don't have to get into too much detail about the different types, but it is helpful to know like, where are those different synovial joints. I also mentioned this a minute ago, but there are ligaments and tendons. So when it is a ligament, it is bone to bone. So think about your LCL, PCL, all of those ligaments in your knee that you may have heard of. Maybe somebody has torn one of those ligaments. Those are connecting bone to bone around your knee to help with movement and to help with flexibility, those sorts of things. And we also have tendons, and those connect bone to muscle. So you can see the tendon here and a ligament here. If you were to tear your ligament, that would be a sprain. And if you were to tear a tendon, that would be a strain. With the tendons, they are usually more stretchy than a ligament. You can get what's known as like tendinitis in your tendons due to overuse, or I had tendinitis in my Achilles because I was going from not running a lot to running like 10 miles relatively quickly. And so that caused a lot of tendonitis pain for me. So that inflammation of the tendon. So stuff like that can happen. Within the skeletal system, it has multiple functions, some of which you probably have thought of before, but others maybe you haven't. The skeletal system is protecting our vital organs. So it's protecting our brain. That's why we have our skull. We have the ribs, which are protecting our heart and our lungs. And so all of that is used for that protection value that it brings to us to protect us from any potential damage. Our bones also store and release fat, which can help with, fueling our bodies. They produce blood cells. So if you were to look within a bone, there are blood cells within our bones. They store and release minerals. They facilitate movement, which is, again, one of the things you might think of. And they also support our body. Again, something you may have thought of. But those minerals and blood cells are something maybe you haven't heard of before, or the release of fat. Within our skeletal system, we have two different parts. We have the axial and the appendicular. Axial, that's kind of our like center core. So it's our brain, it's our skull, our spinal column, and our thorax. So our chest, basically, our rib cage, all of that in blue here. And that's what's used to protect our body from any damage. So protecting our brain, our heart, our lungs, our spinal cord from any damage that could be caused. We also have our appendicular, so that's anything outside of that trunk region. And this is used for movement. So these are our arms, our legs, the things that help us to be able to do things, to walk, to move, and provide us with that structure as well. So just a reminder that axial skeleton, so those are the different parts, and our appendicular. So all of those different regions or different bones working together. Within our bones, they have a specific structure to them. So we have cortical bone, trabecular bone, marrow, and periosteum. So our cortical bone, that is the hard bone that you probably think of because you think, at least I imagine bones as being really hard, which is true on the outside, but on the inside, it's more of like a spongy type of material, which is that trabecular bone. So on the outside, we need that hard bone to protect from any potential damage, but then within that, we have this trabecular bone that is porous and able to protect from any kind of damage or gravity's influence on our bodies, like when we're running and things, that it won't break that bone. We also have marrow within our bones. So you've probably heard of bone marrow before. Within that bone marrow, it contains stem cells. And then we also have the periosteum, which is the thin membrane that covers the bone. And this is where a lot of those nerves and potentially like blood vessels may be located. And so all of this kind of working together to create our bones. So pretty interesting. It's not just this hard object, just, like what you would think of, that does have a lot of complexity to it. Bone remodeling is something that happens. We don't really know it's happening, which is the really cool thing about our bodies and how they work, but it is used as a way to repair itself and actively work on remodeling. So by developing those different restoration type of processes. So we have bone reabsorption, which is the removal of bone by absorption. So that's through osteoclasts. We have bone formation, which is the creation of new bone, or bone deposition, which is the osteoblasts. And then we have the fully formed bone, which is the osteocytes. And so our bodies are constantly going through this process: bone reabsorption, bone formation, and then the fully formed bone, or the osteocytes. And so we don't know this is happening, but this is a way for our body to continue to repair itself, to become, as strong as possible, and to not have that wear and tear that comes over time, just, as we get older. Our bodies are naturally doing this. So it's pretty cool how it all works. There are some age-related changes in the skeletal system, things you probably have thought of before, one of which is osteopenia, which is a condition that begins as you're you lose bone mass and your bones become weaker. Think about, if your grandparents, they might have said, I used to be 5'6" and now I'm 5'2". That kind of decompression that happens over time due to the gravity, due to age, all of those things kind of playing a role. We also have changes in our cartilage, which can cause some difficulty with movement, some pain that we might feel as well, due to that kind of breakdown of cartilage over time. We also have changes in the intervertebral discs. So those, again, due to time and to different maybe sports that we play or different just life happening, that can break down that vertebral disc. So those are between the vertebrae. And so this can also be part of that reason for people getting shorter as they get older. And then changes in tendons and ligaments. People usually are not as flexible the older they get. And so that's something that's really important to continue to work on, is doing things like yoga and aquatic therapy to work on those muscles and to keep them as loose as possible so that you can help with movement and all of that. There are different components of our muscular system. So within that muscular system, there is cardiac muscle, smooth muscle, and skeletal muscle. And so this is also part of the skeletal system. So we have our bones, but then within that, we also have our muscles. And so those play a key role as well. So skeletal muscle, as you would imagine, that's related to your bones. These are kind of those common muscles that you probably have thought of before. Your biceps, triceps, your hamstrings, those sorts of muscles would be considered your skeletal muscles. We also have smooth muscles, which are found in our organs. So like our small intestine, large intestine, windpipe, our lungs within our bronchi, walls of blood vessels, that sort of thing. These are used, they need to be smooth because it's the movement of certain objects. So whether it be air or blood or the breakdown of food through our body, it needs to move through a smooth type of muscle. And so that makes sense. And that helps with that movement of objects throughout our body. And then we also have cardiac muscle, which is in our heart. And this helps with the movement and the function of our heart. The purpose of muscles, we do have voluntary muscles. So things like our muscles that help with our posture, the muscles that help us with being able to walk, to move. They are the muscles that you normally would think of when you automatically think about muscles. But we also have some involuntary muscles, and those are what help with things like digestion, with expulsion of different substances. So whether that be, coughing or whatever, however we expel that substance from our body, the regulation and size of body openings, and the regulation of the diameter of some of the tubes. So things like blood vessels, dilation, vasodilation, that sort of thing that we don't really think about, but it is happening naturally in our body. So a lot of amazing things that our body is doing to help us to be able to live and to, move and do all the things that we may or may not think about all the time. Characteristics of our skeletal muscles, we have these different characteristics which help us, our bodies, to move, to do the things that they do. The first is excitability, which is the ability to respond to a stimulus, which may be delivered from a motor neuron or a hormone. There's also contractibility, which is the ability of muscles to forcefully shorten. So think about like contracting your arm. So you'd be bringing your hand towards your shoulder and flexing, contracting that muscle. Then there's also extensibility, so doing the opposite, so lengthening your arm to extend those muscles, which is that ability of the muscles to be stretched. And then elasticity, which is the ability of a muscle to recoil or bounce back to its original length after being stretched. So again, some amazing things that our body can do. And the importance of why flexibility is so important as we get older, to be able to still be able to do what this older individuals doing it in the picture. So being able to do that because of how our muscles work and being able to practice using them and, stretching them all the time. Age-related changes in muscles. So we have skeletal muscles where there may be fewer muscle cells or fibers. So we might see some atrophy. So as individuals get older, their muscles will begin to get smaller. So you can see that in this picture. So this is somebody who would be active, how their muscles look versus someone who's inactive. And so with that atrophy can come the potential for falls, for any kind of damage that could occur due to that lack of muscle, lack of ability to pick up objects, or potentially pulling a muscle because of the atrophy. And also sarcopenia, which is a syndrome characterized by progressive and generalized loss of skeletal muscle mass and strength, and correlated with physical disability or poor quality of life. Factors that affect sarcopenia are age, gender, and level of physical activity. So encouraging older adults to continue to be physically active, to go for walks, to go to the pool, to do those things is really important. And then within our cardiac and smooth muscles, we have loss of elasticity and loss of muscle strength. And that is also really important to know, because that relates to our heart health, to our digestion, all of those functions within those cardiac and smooth muscles that we need to be able to continue to function properly. Oops. Sorry, that was from when I taught in person. Okay, so moving on to talking about arthritis. So arthritis is one of the conditions that relates to the musculoskeletal system. Arthritis is inflammation or degenerative changes in the joints of the body. It is usually associated with aging, but it also could be associated with an injury or trauma. So you'll notice in individuals who play sports for long periods of time will develop arthritis due to that impact that those sports are having on their body. Can cause that arthritis as well. It's most commonly caused by disability, or most common cause of disability in the United States, and affects 24 million adults. And 22.7% have a doctor diagnosed arthritis. And although it usually is in older adults, it could be found in children as well. So keeping that in mind, that you may, no matter the population, see arthritis in your patient. Some of the arthritis related causes could be osteoarthritis, rheumatoid arthritis, spondylitis arthritis, and a viral arthritis, so through viral infections. Unrelated causes of arthritis, fibromyalgia, hemarthrosis, hypothyroidism, or depression. So kind of understanding the difference there of what can be an arthritis related cause versus what would not be. Understanding the difference between osteoarthritis and rheumatoid arthritis. These are probably the most common two that you have heard of before through commercials and different things. So osteoarthritis is a degenerative joint disease that is considered the most common type of arthritis. This type of arthritis is caused by the breakdown of cartilage in one or more joints, which is, part of that osteoarthritis definition. It's also called the wear and tear arthritis because it usually is caused by, playing certain sports or just the impact of age on an individual. It can cause things like pain, stiffness, limited range of motion, joint inflammation, creaking or grinding of the joints, and joint instability. Anyone can develop osteoarthritis, but it's most common after the age of 65, and usually due to the repetitive joint movement, injuries, being overweight, those sorts of risk factors. On the other hand, rheumatoid arthritis is a chronic autoimmune disease that causes inflammation to those joints. And so it can be really painful as well. With rheumatoid arthritis, there can be symptoms such as fever, weight loss, fatigue, long-lasting morning stiffness. So like getting out of bed can be really painful for somebody with rheumatoid arthritis. They usually have joint pain and swelling as well. They don't really know the exact cause. They do know it's an autoimmune disease, but the risk is inherited. So usually from somebody else. If somebody in your family has rheumatoid arthritis, you are 5 times more likely to also develop rheumatoid arthritis as you get older. How they diagnose is through medical, physical exams, lab results, and imaging testing. It is not curable, rheumatoid arthritis, but it is manageable. There are treatments available, including certain medications that can help in relieving some of the pain and swelling and inflammation. So this again just kind of shows you the different types. So arthritis again is that swelling and tenderness of one or more of the joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsens with age. The most common types are that osteoarthritis and rheumatoid arthritis. So this again, just showing you what rheumatoid arthritis looks like. It's an autoimmune disease. You can see some of the specific characteristics that you might notice in somebody with rheumatoid arthritis. Usually the inflammation is symmetrical. So if it's happening on the left side, it's also happening on the right side. And it can cause some joint deformalities, like you can see in the hands. It's very painful. It causes that swelling as well, and like redness, and can be very painful to the person who has rheumatoid arthritis. Some of the risk factors, it's hereditary, like I mentioned. If the individual has a family history of rheumatoid arthritis, they're 5 times more likely to develop it. Also, environmental factors can play a role. Trauma has been associated with rheumatoid arthritis in some circumstances, as well as lifestyle. So smoking can potentially be a risk factor for rheumatoid arthritis. The prevalence, the onset is most present in adults 60 years and older, but can be diagnosed at any age. And it is very prevalent in the United States, as you've probably heard from commercials about medications and that sort of thing. With Siri's trying to talk to me. With osteoarthritis, this is again that most common form. What I like about this picture is you can kind of see what's happening. So it's the breakdown of this cartilage, which is causing that bone to rub against bone. It's really painful. It causes those bone spurs to occur. And it's due to that wear and tear on our bodies from injuries, from sports, all of those things that can potentially cause that damage to our cartilage and cause pain to our bones. With osteoarthritis, the risk increases with age. Women are more likely to develop osteoarthritis, where things like repeated stress, wear and tear, all of those things can increase your risk. So playing certain sports, bone deformalities, certain diseases, all of which can cause osteoarthritis. Some of the symptoms for individuals with osteoarthritis, things like pain and stiffness is common at different joints. The same thing like with rheumatoid arthritis, getting out of bed in the morning can be really painful. Sometimes for people with osteoarthritis, the weather can also affect the arthritis. They may have tenderness and swelling, loss of flexibility, this grating sensation, so feeling like bone is rubbing against bone, and bone spurs. And so you can kind of see what that looks like in comparison. So a lot of swelling in the bones or at the joints, and then also they might have these nodes that develop at the joints as well. All right, so now we are going to watch a video about arthritis and kind of a quick overview.